are you today?
I'm fine.
Good. My name is Chelsea Sheets. I'm a student nurse at State University. I'm going to be giving you some injections today. Can you tell me your name, please?
Diane Moffett.
And your birthday?
4/26/65.
Very good. Alright, we're going to be doing two kinds of injections today. One's going to be a subcutaneous shot, and where these can go is on the front of you. They usually go on your abdomen or on the top of your legs. And then if you turn around for me, please. On the back, we can do it right here in the back of your arms, at the top of your back, or in your lower back. And you can kind of pick which one, wherever you want it to go. And then for the intramuscular shot that we're going to be giving you, they can go in 4 different locations. If you step right here for me, I'll show you where those are. This one's going to be in your deltoid muscle. And right here, we're going to find the top of your shoulder. And we're going to put a hand on it. And what I'm going to do is I'm going to pinch up on this deltoid muscle. I'm going to give it to you right there. Another spot that we can give it is going to be your vastus lateralis. It's going to be right here on your thigh. I'll put one hand up here and one above your knee. And we're going to find the midline of the front of your thigh and the side of your thigh. And we can give it anywhere in between there. And then the last 2 places that we're going to give it is if you pop your leg up for me, please. Oh, you can put your foot down, just a knee bend. And what we're going to do is we're going to find your greater trochanter right here. And then we're going to find the top of your iliac crest. I'll move my hand from your greater trochanter up to your iliac crest. And my fingers are going to be spread right here. And I'm going to line up my middle finger with the middle of you. And we can give it in your ventral gluteus, which is going to be up front. And it's going to be between my middle finger and my pointer finger. Or we can give it to you in your dorsal gluteus. And that's going to be between my middle finger and my third finger. So one's going to go in the front and one's going to go in the back. We can let you pick whichever one you want of those. And we'll do that momentarily. And to draw up the injections, I've performed my hand hygiene. And I'm going to put on my gloves. Okay, the first one we have is going to be the subcutaneous. And with these kind, the gauge is going to be between 25 and 27, and the length of this needle is going to be 1/2 inch to 5/8 inch. And for this, we're going to pop the top off so that we reveal the needle. We're going to pull back the ordered amount of fluid. We're going to pull it back in air, and then we're going to insert that. Before we do that, we're going to recap. I'm going to take the alcohol swab. Because this vial has been opened previously, we're going to clean off the top with alcohol. I'm going to uncap my needle, and I'm going to insert it into the top of the vial and push down the air. I'm then going to tilt my vial up and retrieve that amount, making sure that there's no air bubbles. And then we're going to recap our needle doing the scoop and cap. And then for our intramuscular needle, this one's going to be between 20 and 23 gauge, and it's going to be a 1 to 1.5 inch needle. And for this one, I'm going to attach the needle portion on. It just screws on. And I'm going to uncap the needle, pull back the amount of air that we're going to need fluid, insert it into the top, then we're going to insert that air. Then I'm going to tilt the vial up, retrieve the set amount of fluid, making sure there are no air bubbles. And then we're going to scoop and cap. Whenever we go to inject the medication, we're going to, this one's going to be the intramuscular one, and I'm going to take my alcohol swab and I'm going to clean from inside out on the patient. And then I'm going to uncap my needle, and I'm going to insert at a 90-degree angle using a dart motion. And then I'm going to insert the fluid. and pull it out and hold pressure. I'm then going to put my needle in the sharps container. And then for the subcutaneous, I'm going to take the cap off my needle, clean the patient again with my alcohol swab in a circular motion from the center out. And then I'm going to pinch up the skin, and I'm going to insert at a 45-degree angle. And insert my fluid and pull out and hold. I'm then going to recap my needle using scoops and put in the sharps container as well. And then I will document that I inserted the medication and go from there.